This is the CMU EDUcast, all about issues and new ideas in education in Thailand. I'm Chris Mangum. This week, Promoting Mental Health in Schools, Part 2. The classroom is often the front line when it comes to recognizing and responding to the real mental health issues that teenagers and young kids can experience. How can we prepare teachers to be first responders? And what would that look like in the context of a Thai classroom? We now pick up with part 2 of my conversation with Aj.Nanthaka Fuseekul, lecturer of psychology at Chiang Mai University's Faculty of Education. She spoke to us from the University of Reading in England, where she's finishing her doctoral degree this year in clinical and educational psychology. You know, my layperson's understanding of clinical psychology, I have this very old-fashioned idea that there are two categories of mental illness. There's psychosis, which are real, very serious ailments where people are not participating in reality, as everyone knows it.
Yeah.
And then there are lesser things that we're often, now I know they're not called neurosis anymore, but it seems like there are different levels of severity and really different kinds of psychological and psychiatric disorders that are really not related. So there's a real broad spectrum of things that can go wrong with people. So this is a very broad area. As a clinical psychologist, you have to be a net that can catch all of those things.
Yeah, and it's quite complicated things as well. So sometimes when people ask me how to deal with this kind of situation, I said, no, we can't answer that answer now. We can't answer that question now because there are lots of things that we need to know before we make the decision on that case, before we know what's going on that case. So for example, like a bullying in school, sometimes we say, we might see that, that kid who bully others might have like just aggressive behavior or they might have impulsive. But if we go back and look inside in his life, for example, like a family problems, do they have like other problems as well? Do they have mental health issues as well? So we need to look deeply into their life before we make a judgment or maybe
Yeah, so it would seem that there's like a lot of comorbidities with something like bullying, and it's not enough just to stop at the bully because oftentimes he or she might have problems at home. Maybe a parent has a substance problem. Maybe the child's being abused or neglected. Maybe there's a family problem. Maybe there's a real psychiatric issue. So there's this whole spectrum of possibilities. And so my question now comes back to kind of, here you are, you're a superstar. You've gone to England to get a PhD in psychology, and you're kind of a bridge between educational and clinical psychology. You're really an expert. And your mission now is to create a community in Thailand that will solve this kind of problem. So you're going to come back and train people, I presume.
Yes.
And you're going to be working, I think, with teachers. Is that right?
Yeah, that's right. Actually, before I come to study in the UK, I have give a lecture to the first year student in the subject called educational psychology. It's like a one module that is mandatory for the first year student to learn about psychological theories and psychological concepts that they can put into practice in school. And they also learn about the basic counseling skills. It's just only one module. But I think when I get back, we need to improve the course or maybe at the pre-qualification or post-qualification to provide more information about mental health in school. I think this is very important. So as you know that in Faculty of Education, we have the professional development training for teachers to improve the teaching performance for teacher. But we still have small course for teacher to understand more about mental health. So maybe that would be a good start that I can create and develop the course that would be useful for teacher to know more about the mental health problems like anxiety, depression, eating disorder or schizophrenia or other mental disorder that commonly occur in young people. So teacher would know that when they have students experiencing in mental health disorders, what the thing that they can do or where they can ask for help or what is the initial thing that they can provide for help those students.
If your plan works, it will help many, many people, I think.
Yeah, I hope so. Yeah.
Because teachers go to all corners of Thailand. They will go to the cities, to the inner city. They'll go to the most remote rural villages too. And so if your plan works and your work is successful, you will be serving children all over the country in many different settings.
Yeah, that was my purpose, I think.
I think that's a beautiful vision and a beautiful...
Yeah, and it's quite a big challenge as well.
So let's talk about the challenges a little bit. Let's talk about what are the things standing in the way. When you come back and you start putting your team together, it's not going to be easy, I think. You must have an idea of what the challenges will be. What are those challenges?
The big challenge is just the teacher's attitude towards children with mental health problems. Because sometimes teacher might think that students who have mental health problems is like a burden person that can make the classroom not in the good place or the fun place for other children. And they are more likely to say that, yeah, maybe the mental health problem students, they might cause other problems in the classroom as well.
Mental health is another area where teachers can be first responders. They're the first person to see the problem. They're the first person who can respond.
Yeah, that's right. Yeah. Yeah, I think because students spend much time in school and the person that's quite close to them rather than parents is teacher. So in Thailand, we normally believe that teacher is our second parent, and most of students, they quite count on their teachers. It's just only we don't have the training about mental health for teacher that much. So that's why they don't think that this is my responsible to take care of students. But actually in school, teacher, they just not only teaching or just preparing students to do the test, but they need to have the other responsibility as well. Because I think every school teacher need to assign to be the classroom teacher. Like they need to take care of students in one classroom. We need to see if they have in children welfare or well-being. So we need to focus on that.
Is there other training that teachers get for things that are related, like identifying abuse or for medical problems that the kids have? Do teachers get trained in other ways to intervene if they need to do an intervention?
Okay, so as part of my PhD, I have explored about the training experience among teachers about mental health. And over 90% of them, they say they never attend any mental health training before. So I think 90% is quite a huge percentage to say that there is no such a training like that for teacher. And when I delivered mental health training for teacher to collect my data to see that the training, it works, because I just want to examine the feasibility of developing the mental health for teachers. The finding found that teachers perceive need to have that kind of training, but it's just no one provide that to them. So we need to go back and think about why there is no such training like that in Thailand. There might be some of the training out there, but it's just not put into research. But it's just not the thing that is a routine in Thailand. It's not a routine in Thailand to have the training like that for teacher. Because every time that teacher go to the training, it's just only about to improve their teaching performance or their role to improve their skills or some kind of that. But it's not mental health.
So your work when you come back will be to work towards some kind of policy or a national effort or a national standard.
Yeah, that's what I thought as well. Mm-hmm.
It seems like your work will be divided between the practical job of reaching all of these teachers and building a team to do that. And then also maybe another part of your job will be to change policy and to influence policy so that this must happen by law.
Yeah, I think I'm gonna go like a step by step, going with the small step first in our Faculty of Education. And then if it works and if there are need out there, so I might need a big step to go to the policy changes.
So we've talked a little bit about some of the misconceptions that people can have about mental health. And it would seem to me that that would be part of your work, is to address many of those misconceptions.
Yeah. Or it's just only when people asking me, what are you study? And I say, yeah, I'm studying psychology. And people, whoa. And I asking them, what whoa? What does it mean? And they said, you might have learned about, studying mind and you know what I'm thinking. I said, no, not that way.
First of all, psychology is a huge, giant field that has so many different things that are not even related, actually. And it all comes back to the common phenomenology of thinking and of behavior. But they're very different branches of psychology, social psychology versus clinical psychology versus, they're all, even like in learning theory, there's very deep learning science that's based in psychology.
Yeah, that's right.
Yeah. So you can learn so much about one little area and not about the other.
Yeah, I think that the good thing that I have the degree in clinical psychology is being trained to do like skills that necessary to work with a patient, like a counseling skill or psychotherapy skill, or do the assessment or do diagnosis that we can apply to do in our life as well. So it's like counseling skills that we have learned we can do with our families or students and friends and kind of that. And we kind of understand them very well because we do a lot of assessment and we do more tests, like a personality test or like an attitude test, or sometimes like a mental health assessment as well.
Would you be teaching teachers how to do some of these assessments toward a diagnosis?
Yeah. I think because diagnosis needs to be trained, but for the self-report, like a self-assessment, I can teach the teacher students to do this. And now because they are the website, like Ministry of Health, that they provide the self-assessment in their website, that student can easily to get there and, get the result and know what happened to them. And then they can look for more information about that.
So there are some resources already from the Ministry of Health that would support teachers identifying issues in students.
Yes, of course.
That's great. Yeah.
I mean, a lot of times these are just checklists, right? So check the box if you
check the box. Yeah, right. If you have 9 symptoms out of 10, and then you might have you get.
But this is really, of course, not diagnosis. This is just
the pre-screening.
The pre-screening, right?
But most of people, when they finish their self-report and then they saw that the result, it mentioned that they have, for example, depression, but actually they just have risk to have depression. So they need to go to see the professional to confirm that they really have it. Because sometimes when we do self-report, it's just not guaranteed that you have it.
I always thought that just by the fact that people are taking the test or the people Google the self-assessment, that is already checking a box. That's already telling you as a mental health professional that they think maybe there's something wrong.
Yeah, that's right. And most of people, they believe that they have from, reading all of the symptoms. Oh, I have that. Oh, I might have that. But actually, they don't have that. You need to go to the hospital to see the professional and to confirm that you have that particular symptoms or disorder.
This is I think it's a famous thing that happens to medical students. They read about these very rare diseases, and many medical students become convinced that they have some of these diseases. Have you heard about this before? In medical school, you read about all of these different pathologies.
Yeah.
And there's a very high rate of medical students who self-report as having one of these pathologies. And
Interesting.
so they're like, oh, I must have cancer. I must, or they must have.
Yeah. But I heard from the joke on the internet that they said, when I get headache and then I go on the internet, oh my God, because sometimes you just have like a migraine, but you turn to have yourself like a cancer, like a tumor in your brain.
When we're having a bad day, we're all in a position where we could be very vulnerable to suggestion.
Yeah, that's right. That's correct. Yeah.
Right. Yeah. So that's something to be aware of. And that's another interesting twist in what you're trying to do.
Yeah, that's right.
Are there other models? Are there other people doing this in other similar cultures and countries that you've connected with that you're aware of?
For example, in the UK, now they are trying to convince a teacher to take course in the mental health first aid. It's just like to learn the fundamental of the mental health that commonly occur in young people. And the government is pay for teacher to take that course because sometimes they has fee to take the course, but the government try to encourage all of the teachers around the UK to get that training to make sure that they're gonna use the knowledge and skills from the course to put into practice in their schools and can help to reduce and decrease the incidence on severity of mental health disorder in school.
It would seem that would be one of the things that you could use when you come home is to point to other countries and look at other policies to say, look, all these other countries are doing it. Let's do it too.
Yeah, but in the UK, they have been started for, I would say, like 5-6 years ago that they had started to have like a training like that until they get the attention from the government. It's like the group of researchers that they try to bring the knowledge from psychology to put into school because they concern about the high rate of mental health disorder among young people that quite increase every year. I think it's all about the attention that they want to tell out there that this is a serious and we need to pay attention more about this and we need to do something now before it's getting too late.
So when it has worked in other countries, it started in many cases because of grassroots efforts from the mental health professionals themselves. Yes. So they started doing something because they saw the problem and then government became involved. So maybe that will be how it works here too.
In Thailand, I think there are many mental health professionals that would like to do the same thing, that try to focusing on prevention and promotion of good mental health. But because you might have some problem about the funding or like the support from the stakeholder, that sometimes is quite hard to continue to doing this. But if we can gather those mental health professionals with the people who expertise in mental health come together and try to see the grant or, do some kind of thing. Yeah.
Wow. So once again, I'm so happy to have you join us because what you're doing, your work is so important and has the potential to help so many children and so many people in Thailand and in other parts of the world too. I'm very excited about the work that you've done so far and the work that you're going to be doing in the years to come.
Yeah, and I hope this is going to be helpful for not just only students themselves, but also teachers. Because lots of people, when they learn about mental health, to help other people, it's not just only help others, but you can, use that information and knowledge to deal with your own condition as well.
Yeah, so teachers need to be able to take care of themselves too.
Yes.
And this might be part of that skill set.
That's correct. Yeah.
Well, you've sold me. I'm convinced.
Yeah. Hopefully, hopefully when I get back, I should start the project as soon as possible and to see, how to develop and how to expand the course or the project this into other schools or other teachers around Thailand. Yeah. I hope this would be a useful thing. It's quite difficult, isn't it?
Yeah. It's uphill. I think you're going to get the Nobel Prize doing
Oh
this.
no, I don't want a Nobel Prize. Yeah.
I think so.
I mean, it's just only thing that I can pay back from my country. It's just the only thing that I have learned a lot from here because they sent me, they are supporting me to come here, and then I would like to bring back something that very helpful and very in the positive way.
I think so. I see it happening, and I think you are in the beginning of something great. So thank you again so much for your time. Thank you for joining us.
Oh, thank you so much for having me today. It's such an honor to do the podcast with Chris and in a part of the Faculty of Education.
The CMU EDUcast is a production of the Faculty of Education at Chiang Mai University in Thailand. For more information, visit us at cmu.ac.th. I'm Chris Mangum. Thanks for joining us. We'll see you next time.